So today I'm going to be talking about why does infection keeps coming back after treating it. Now, I'm not restricted to yeast, vaginal yeast infection, but vaginal yeast infection is included, okay? And in this context of why does infection keeps coming back despite after treatment, I don't mean other kinds of infection. I mean like STI, sexual transmitted infection like gonorrhea and you know the kind of infection I'm talking about, not malaria, not typhoid. Those are infections, but not the kind of infection I'm talking about right now. Okay, I'm talking about infection that has to do with reproductive organ when you have sex and stuff. That after treating it, I have this question. People say, especially the men, women, you think you're the number one. You are not the number one people that are having these issues. Men are having these issues. They're like they are all plenty on my DMs, okay? Having these issues of treating infection, you treated gonorrhea or you treated infection, you know what I mean? And after like a month, it comes back. Or after like 2 weeks, it comes back. Women, same thing. They have this issue when it comes to vaginal yeast infection, okay? Candidiasis. Well, what else you should know when it comes to women yeast infection is that men can have yeast infection too. So as I'm explaining, have that at the back of your mind that you're not the only one that can have yeast. Your boyfriend can have yeast infection. You can give your boyfriend yeast. Okay, so a quick one. Remember, why does yeast infection keeps coming back after treatment? Okay, and after that, I'm going to also talk about difference between yeast infection, vaginal yeast infection, and then other kinds of infection. How do you know as a woman that you are having yeast infection and not the other kind of serious STI infections? Okay, because this video is for men and for women, not only for women. Okay, and I'm going to be talking about also signs that you're having yeast, because people don't even, they're like, yeast, please, what is this yeast? How do you know you're having vaginal yeast infection or candidiasis? I'm going to be talking about that one. So a quick one, let's get straight to the point. Why your infection keeps coming back despite treatment, after treatment. Okay, first of all, number one, after treating infection, if you've treated yourself, there's what is called contact tracing. If, let's say, you treated gonorrhea, okay, you're a man or a woman, you treated gonorrhea or whatever you treated, please after treating that, as you're treating yourself, you need to also call your partner in. All the people you slept with, you need to call them in and get them tested and treat them also. And then before you reduce sexual intercourse with this person, you people will need to hold on after the medication for like 1 week or 2 weeks, then go back for retesting. Okay, when you guys are clear, then you can resume sexual intercourse. Why am I saying this in this? This is because when you treat yourself, okay, after treating yourself, you didn't treat your partner, and then you're okay. Remember, you have the infection. Your partner is having it too. Either you gave it to her or she gave it to you. But what I know is the two of you have the same infection that you're treating. So if you treat yourself and you don't treat your partner, after treating yourself, you still go back to your partner and then you have this sexual intercourse. She or he gives it back to you. So you'll be having rebounds. It's as if the doctor does not know what he or she is doing. Another one is this: you're treating infection and then you are still having sexual intercourse with someone else, somebody. How will it work? You're killing the bacteria or whatever and you're still bringing it back. So if you're treating sexual infections, calm down, chill, okay? Chill, finish your course of therapy, go for tests, and then make sure you're okay. Same thing as your partner. You guys must be medically confirmed to be okay before you will start. Don't just, feel you treated yourself, your partner has treated themselves, you just resume. No, you have to go back, because most of the times there might be resistant infections. Go back to test and make sure that it has cleared out of your system. A doctor gave you 5 days course of antibiotics. Don't feel that because you finish the 5 days, you are okay. No, the symptoms might subside when it comes to infection, serious infection. After finishing the course of 5, still go back for retesting. Check if that organism has died, if the antibiotic has died, has killed it, very well. Because most of the times, if these antibiotics have not, these organisms have not really died, maybe they just calm down. By the time they come back again, it's like in two folds. Okay, the antibiotics you took might not really work. Okay, so this is very interesting. The antibiotic resistance. Yes, antibiotic resistant. Stop taking prescriptions online. Please. That's why it's as if most people think I don't give them prescription. First of all, I'm a nurse. I'm not supposed to prescribe, okay? I have a limited over-the-counter drugs I can tell you to take, but I'm not supposed to prescribe. Stop taking prescription. When you feel you have an infection, see what happens when you feel you have an infection. Look at the due process to take when you have an infection. Go to a hospital or to a clinic. If you don't have money to go to a big hospital, okay, go to a hospital or a clinic. They will take a sample from you. The fluid coming out of you, if it is the male, they will take a sample from you. If it is the female, they will take a sample from you in your V area, okay. They will give you something. When this thing is being done with it, the test will be cultured and find out antibiotics that are not resistant to that organism, because you've been taking a lot of antibiotics lately, okay. So there are some antibiotics that you would take, the microorganism, the bacteria will still be there, it's not going anywhere. So when you go to the hospital or to go to do a laboratory investigation, this is what they do. So they bring it out and find out the antibiotics that will work, or antifungal that will work on what you're having, and then you get treated. But when you go to a chemist or to a pharmacist or to anywhere to just take antibiotics like that, you take it, you don't even know what is happening. You take it and you can take antibiotics that is very high, more than the infection that you have. And over time, you will now get resistance, okay. You can have a small an infection that a small single spectrum antibiotics can cure, but you go and take a very big antibiotics, like broad spectrum antibiotics like augmentin, for something very small. Over time, you will now get resistant to that antibiotics. And when you have serious infection over the future, because we don't know, this is future, we don't know what is going to happen to us. A serious infection that broad spectrum that you took that time would have worked, now when you take it, it will not work. Death will occur. So you see why you need to go through the due process of getting treated if you have an infection, okay. So in that aspect of going to the chemist to tell them, so when you now build this resistance, okay, and or you don't even know, you just keep taking any antibiotics that you see, the infection will keep coming back, because they keep getting used to different antibiotics that is not even what you're supposed to take, okay. But when you go to a lab, an investigation, this will be so much easier, okay. And then after treating, you go back and do the test, just like as the sequence I explained to us before. So another one of the causes of recurring infection is low immunity. Yes, when your immune system is low, it loses the specified ability to fight for all these small infections, okay. So you need to eat well, you need to build your immune system, take vitamins, work out, eat healthy vegetables. It will reduce the way you have infection is coming, you might not even know, before you find out your immune system has fought it off, okay. Especially in vaginal yeast infection. Please, okay. So in vaginal yeast infection also, I think I'll talk about vaginal yeast infection in another video, because so that it doesn't complicate this video, okay. So that's it. Another one is some medical conditions, like if you are diabetic. Yes, diabetic is when there's excess sugar in the body. Now you know sugar, that's why diabetes, when they have wound, it's very difficult for the wound to heal, because sugar thrives. Sugar doesn't promote healing, okay. Sugar, you can imagine when you bring sugar, there is ants will surround the whole place. Sugar gives room for infection. So most people that are even diabetic and they don't know. If you find out that your yeast or some infection keeps coming back or it doesn't go, try to also know your sugar level. Okay, in some you can check it in some chemists or in some pharmacy. I think it's 500 naira, less than 500 naira. Some hospitals are free. Okay, so some illness will make it hard for you to for infection to go and it keeps coming back. Like this video, share